Here is the Crescendo Music Education Podcast, episode number 64. When I'm 64. Does that go in your head too? Okay, anyway, welcome! This podcast is being recorded on the lands of the Turrbal people. I acknowledge them as the traditional owners of the land and pay my respects to elders past, present and emerging. They were the first music makers on this land. Hello everyone, Debbie O'Shea here for another fabulous episode. I'm going to speak to Dr. Ryan Williams, GP, Medical Educator and the conductor of the Queensland Medical Orchestra. Absolutely fascinating conversation. In this first half, we get to talk about teachers as professionals. We chat a little about the sometimes unrealistic expectations, particularly around assessment, I guess. He says that he stands with us. He has great sympathy. We talk a bit about the brain and learning and framework and scaffolding and that gradient of learning. It's not just empty the content into the empty heads. I resonated with everything he said. So welcome to the first part of my chat with Dr. Ryan Williams. And I would like to welcome to the Crescendo Music Education Podcast, Dr. Ryan Williams. Thank you so much for joining us, Ryan.
My great pleasure, Debbie. Thanks for having me.
Now, the way I like to start is to just read a bit of a brief bio so that people can hear a little bit about your background. And I came across you as the conductor of what's the initials? What's your...
QMO, Queensland Medical Orchestra.
That's it, QMO, Queensland Medical Orchestra. So we'll start though with your bio. Ryan is a GP and medical educator, graduating from the University of Queensland School of Medicine in 2011. He is also the conductor and artistic director of the Queensland Medical Orchestra and has been in this role since 2010. His musical studies began at the age of 8 with the viola and piano, and he began playing flute, bassoon and percussion during his high school years. Ryan spent 2 years playing viola in the Queensland Youth Symphony under internationally renowned conductor John Currow. You do say Currow, don't you? Yes. Yeah. OAM. And toured with the orchestra to South Korea, Switzerland, Italy, Austria, and Germany. Oh, that sounds great. Culminating in a performance at World Expo 2000 in Hanover. Ryan studied undergraduate degrees in arts and education at the University of Queensland and began working as a German and science teacher at Ferny Grove State High School upon graduation. In this role, Ryan became an active member of the acclaimed instrumental music department at Ferny Grove, where he conducted several ensembles and performed Saint-Saëns' Carnival of the Animals with Israeli pianist Braki Tilles. Ryan's love of classical music belies his passion for European culture. After completing an exchange in Frankfurt at age 17, oh boy, I bet that was an adventure, he was awarded scholarships to study languages in Germany and Russia. Oh, wow. And spent much time soaking up the culture of Europe's finest musical, artistic, and historical venues. That really does sound like an adventure, Ryan.
I've been very privileged, been lots of places, and quite a Europhile. So they don't have a lot of Vegemite over there, but they have lots of other things that I'm very, very grateful for. So
cheese? No? Are you a cheese?
That's the tip of the iceberg. Tip of the iceberg. Yes.
Oh wow. Well, we will start by just saying, is there anything else you want to add to that bio before we whiz on?
I feel like that's probably enough, don't you think? Yeah, I think that's plenty. I think probably any more your listeners might think I'm sure they already think that I'm a try-hard. So any more than that, and they probably will think he's probably a little bit of a tosser. So I'll probably leave it there.
I
So
don't, I
am I
don't
nerdy
think.
enough? I've got the nerd medal by now. Surely they've all given me a sticker and put me in a basket being, right, he's one of those, is he? So yes, I really am. I'm quite self-aware. It's all good. I've known I am that kind of I am the nerd. I've been a proud nerd since about grade 4. So we're
Oh,
aware of that. Nerd
well,
status complete.
and I do think a bit of it's good to be self-aware. And you know what else? We're really good at giving stickers.
Oh, stickers are amazing.
Yeah. So
Since,
we'll
and
get.
particularly since they brought in amber alerts and amber foods and red foods, like we can't give away gummy bears anymore. So as a German teacher, I'd give away gummy bears, but we can't do that anymore. So stickers is what we're left with. So
Yes.
got to
And
use that. So
even then you can get in trouble. I've got in trouble for putting a sticker on a shirt. You don't put them on shirts because then if the family forgets to take them off before they wash them, sometimes they're left with that little sticky thing on their shirt. So you can,
um,
and
what
stamps.
what's
Stamps
left
aren't always
then?
good either on your
You
hand.
just give them like an Air 5. These like what's left? Like I don't know. What are we going to teach with next? I don't know.
Mm, I
Yeah.
know. Yes, we know those
Gee,
problems. But look, your bio sounds so fascinating. So, in summary, basically, you did music at school, which we're all quite interested in because most of my
mm,
listeners are music teachers, and in Brisbane and
mm,
in the state system.
yes,
Yes,
absolutely. State
represent.
system, great system. Yeah.
And then you became a teacher. You did some extra
Mm-hmm.
music stuff. You became a teacher, but you weren't teaching music in the classroom. You were involved in the instrumental program.
So almost, I actually was. If I kind of, I'll take it on my first diversion. There'll be a few diversions tonight. So to really max out my nerd status, so I after visiting Germany, doing exchange there, my major at university was German language, and so I studied that and sat in exams to become what's called a NATI, translator. So I'm accredited to translate documents and have them hold up in court, all that kind of stuff. So that was kind of my jam. And so I got to the end of an arts degree in German language and Russian language and international politics. And it was kind of like, well, what do you do with that apart from take it to McDonald's and say, would you like fries with that? So then my parents are both teachers. So I went, oh, well, obviously that's in my genes. And I love education, I love teaching. So I went, look, I think this teaching's for me. I did have plans to do medicine when I left school, but then I went to Europe and just went, this is the place to be studying for the rest of my life. That's what a silly idea. Why would you want to be a doctor when you can go and travel and meet these people and study languages and do all this amazing stuff? So I after first year at uni, went, no, the medicine things, that's not for me. Do this travel, do these languages. So I did the languages and I went, well, I can do teaching and do languages and that would be great. So when I studied my education degree, I did some pracs at the same school that I went to, which was Ferny Grove State High. So that's where I went to school, and they were keen to have me and offered me some positions doing prac there. And by that stage, when I started doing prac, this is when we were called prac teachers. We don't call it anymore. I think by then we were called pre-service teachers. I think there's a new name now, isn't there? You don't call them pre-service teachers anymore. Is it something
Yeah, they're
else?
pre-service or student
Okay.
teachers.
Anyway,
Yeah.
so by that stage, we actually had now a German immersion program at Ferny Grove, which means that students are actually taught the bulk of their subjects actually only in the language. So at Ferny Grove, it's in German. So they learn their maths, their science, their social science, or so as many subjects as possible only speaking German. And so I was sort of a bit headhunted to be part of that because my German was of a high standard and I could help expand the subject base of that. And so when I taught there, one of the things that I could teach was music. So I taught classroom music speaking German. So I was teaching them about, beats, which I had to learn was Taktschlag and all these kind of German words for, beat and tone and pitch and rhythm and all these kind of things. So I taught classroom music, but I've only taught it ever speaking in German, not in English. So I still know what the words are, but I had to learn how to teach it speaking German. So I have taught classroom music to year 8s, but it was only speaking German. So that is when I taught it.
I love it. What's your music teaching experience? Oh,
So there you
year
go.
8 teaching only in German
Yeah.
to the fabulous.
So yeah,
Oh, I love it. Yes. So
I've
then,
had an interesting life.
yes. Oh, you so have. And then to go from there to, I think I'll be a doctor now.
Well, there is a link in that. Yes, I didn't just have a psychotic break. I mean, that would have been a plausible hypothesis, but I because I had done first year science and chemistry and things like that as part of the preparation to head towards medicine, and then I kind of gave it away. I did have the science and maths kind of background that I could, so I kind of took over the maths and science after the head of department who kind of set up the program. He went sort of in a different direction towards school leadership and went down the deputy pathway kind of chain. So I took over the math and the science, and I taught that for years 2, 3, 4, and 5 of my teaching career. But every year, as I taught more and more of the science, and we do the digestive system every year in grade 9, and I just every year I would read further and further and further into around the topic, and just kept reading more and more about human biology and anatomy. And I just was like, I just have to. I need to study this. Every year I was reading more, and I couldn't switch my brain off. I was more and more intrigued, and I got to a point essentially, I think I was about 25, and I just said, who am I kidding? I actually am this person. This is what I want to do. I can honestly say I didn't leave teaching because I didn't like it, because I hated it, because I thought this is, I can't stand it. I left teaching when I was on a high going, I really love this. And I kind of went, I think I'm at the peak of, this is where I'm probably at the peak of liking this. And I want to leave when I'm really loving it. I might have loved it for another few years, maybe even 5, possibly up to 10, but I probably wouldn't have loved it for another 30 years. And so I left when I was on a high, and I haven't regretted that going into my second career. But I left it loving it, so that's good. I have really great memories, and I don't feel bitter that I left when I did.
Oh, yes,
Does that make sense?
That does. And I actually think it's great to leave something while you still love it. I think it's always a little bit sad if you wait till you're really at the bottom of something, or you've really had enough, or you hate it. It's a little bit sad. But my question was going to be, is there at any point you've regretted your career change? But I'm gathering you're loving working in the medical profession.
Oh, yes.
Well,
I certainly don't regret jumping to this. Oh, look, every job and career has their good days and bad. It's definitely been the right thing to do. I don't see myself going back to the classroom. I still go back. Most years in the last week or two of school, I still have a great relationship with Ferny Grove State High. I literally had coffee today with my former boss, the head of department for languages there. And I often go back in the last week or two, just some point when I can wrangle a day. Because one of the great things about general practice is I have very flexible hours, and I'm usually my own boss. And so I go back and do some language stuff there just because I can, and just try to sort of keep supporting the program. And so I really do enjoy that. But that's kind of, a day or two, and not, an entire term or this, that, and the other. And there are some things about, this is not a podcast sponsored and paid for by Education Queensland, so I can say things that I hear things about curriculum and assessment and things that I sit there and go, yeah, I'm quite happy to be out of that, because that sounds a little bit ridiculous. So there are things that I don't miss about that, and I don't miss marking. But I am very involved in medical education, so I teach medical students and registrars in medicine. So I've taught at Griffith University all this year, and I've taught at UQ for 5 years. So I'm very involved in education in the medical sphere, and there's great things in that, and there's just as much hoo-ha about, oh, this is the absolute way to teach, and oh, actually no, we've just read some new studies, and this is the way to teach. And you sit there and you roll your eyes, going, we've got reform fatigue, and everyone's got the new greatest amazing way to teach, and every 5 years it's a new way, and it's just this, they're all good. No one's actually completely right, and you just sit there and go, come on, let's just try and anyway. So we roll with it, and everything's good. Every career's got days where it's good, and then the next day you'll have people come in and they'll drop their bundle and they'll scream and shout at you and tell you you're an F and C, and you're kind of like, oh, okay, well, good. Still happens in medicine too, when people don't take their psych meds and they come in and they need to be dragged off to the hospital. But some of my friends who work in education, it's like, yeah, that was my lesson yesterday in 4th grade music. It's kind of like, oh, that was my day in the psych ward yesterday. But I guess they're kind of similar. It depends on which school you go to. So your listeners might be saying, oh, but that sounded like my day in the psych ward. It's like, no, that was my day at X State High. Like, yeah, same. So my sympathy goes out to you music teachers who are kind of nodding your head right now. Yeah. But if I could give you scripts to fill out to send tranquilizer darts with haloperidol or olanzapine, I would, but it's not yet ethically approved. So
no, well, let us know when it is. Okay. I can have a side business.
I'll keep my eyes and ears peeled, but not quite there yet.
I like that term you used, reform fatigue. I love
Mm,
it. Oh, what's one of the terms I use? Because obviously, looking as I'm, nearing the end of my career, I've seen
mm,
many new brooms that have come in that feel, oh, we have to show we're making these big changes. Like, dude, don't throw the baby out with the bathwater. Like,
mm.
there's a lot of good stuff we're doing. Of course, we can always improve. In fact, if you think you can't improve, it's time to get out of teaching, is what I say. You can always improve, but really, there's not always an argument for just, let's just clean slate,
Mm.
let's start again. This is better. Oh,
Oh yeah.
sake. Mm.
So I mean, I'm probably dating myself a bit. I'm not trying to get. I guess I'm probably trying a little bit to get some kudos with your listeners. But so I was trained around the time of Alan Luke's productive pedagogies, and then we came into rich tasks, and then we
Mhm.
had outcomes-based education, and so we went through a number of these things. And I imagine some of your listeners are going, "Oh, I remember that," and like none of those things I don't think were inherently bad, but when it was kind of pitched as being this is the new and greatest way, and everything else before this has actually been suboptimal, and research says this is the way to do it. It's kind of like, but that's what you said about the last one, and then in comes the new one, and then because when I was trained, when I was teaching German, and there was sort of this is the communicative approach is the way to teach the grammar, and everything else it's all been very antiquated, and that's completely wrong, and this is the way to do it. And the supervisor that I had when I was on prac was kind of like, yeah, that's what I was taught 40 years ago, and it's gone around and around in circles, and
Yep.
you go, oh actually, like everything that was old becomes new again. And you sort of sit and go, can't we just say, well, this is one way to do it, but an eclectic approach of saying, well, there's multiple ways. And some students will respond well to this and others, and being able to sort of mix and match and work out which ones will be well for this. And knowing the strengths and weaknesses of multiple approaches and learning to be professionals who can say, well, this works well for this activity and this, pace and leading and flexibility. And these type of things are actually very useful. But we can't say things like, well, now I'm sounding cynical, but having that flexibility and respect for a professional, like understanding that we actually know some of these things is, I don't know, it seems to be a little bit frowned upon. I don't know. Anyway,
It does a
must be
bit.
late at night because I'm getting a little bit cynical.
No, but I think you're right. And I do think teaching as a profession has those issues. I think
Mm,
that we're not looked upon all the time as
mm,
professionals who have this good judgment and who have this flexibility, because you've sort of got to be to survive. When you've got 30 kids in front of you, in our case half an hour at a time, you've got to be flexible and you've got to be responsive, and you've got to have a whole raft of strategies ready to go just in case. But I think there are a lot of people who don't give teachers credit for having that level of professionalism to make those decisions.
mm. Yes, absolutely. And for what it's worth, I was talking to a friend this week at a catch up on Anzac Day, no, on the protocol that we've just had this week, and we just had a bit of a heart to heart. This friend's a music teacher at a school that shall not talk about, but was just catching up and hearing how things going new school this year, and just hearing about what was expected in terms of assessment and where they had to get to levels and what they wanted to do, and just hearing about how much was expected and in a term what was required and the amount of time that they had to actually cover this, half an hour per week. I mean, that's not very much. And then kind of the penny drop, they said that's the equivalent of one day. By the time you sit and map out half an hour per week in an entire term, you put that together, that's one day.
Mhm.
And what was expected in that much time. And I just was aghast, saying that's all you get, and they're expected to have all of this achieved. And I just went, all of that. And then by the time you say, well, if it's half an hour a week, that means, well, you lose the first 5 minutes, you lose the last 5 minutes, and then you get so you're getting about 17 minutes once a week to try and, I say that to anyone who's listening just to give you my empathy, I hear you, I hear your frustrations, I return it with a sense of passion. You are heard, I stand with you.
Thank you, Ryan. What I like to mention in my workshops when I get a chance is that if you have your half-hour a week lessons. And I know some of my US listeners have longer lessons, and some people here do, but generally it's half-hour a week. If you have every week, no public holidays, no sports days, they're never late, they're never sick, you're never sick. So if you have them every single week, you've had them in the year for less than a week.
Mhm.
And so the way that I get around that mindset wise, just a little teaching tip mindset for people out there, is I think of it in a negative way, like Chinese water torture. In a positive way, think of stalagmites with drip, drip, drip. I'm going to just keep covering this content. I'm going to cover it in a really interesting way, in a different way, with different repertoire, a different way to practice, using paddle pop sticks. I'm going to just keep doing all of these different things, dripping the same content, and I will get there with most of the kids in the end over time. But like my program is 7 years. It's a 7-year program, prep to grade 6. And I think if you're at a school for a year, there's very little difference you can make in a year on half an hour a week.
Yeah.
Mm.
If I can add any kind of encouragement to that, is that, and without trying to add any kind of value judgment, just to what we know about human brains and how human beings learn full stop, is that none of us can just open our skull, open our brain, give me information, dump it in there, close my brain, close my skull. I have information. I will now move on. It is done. Like, we have to acquire information, and it takes time. It takes a process, and we have to, there's a number of processes how we do that. And I guess what I'm trying to say about that is, like, being involved with medical education at what some people might say that's a very high level of education. Tomorrow I'm going to be examining medical students who've just been learning for the first time ever in their first year how to use their stethoscope and how to listen to the heart and the chest and try and work out where the parts of the heart to listen to and where are the valves and where's the carotid artery and all these kind of things. We had 1 2-hour session to sort of show them how to examine the heart and the blood vessels and all the way around the whole body. These are incredibly bright students, some of the brightest around, who have to work very hard to get into medical school. And we have 1 session to kind of show them that for 2 hours. Even then, the next time we see them the next week, that's not enough to mean, right, that's it, they've got it, they can then reproduce a week later. Brains are not able to do that. They need to have things reinforced. They have to have, all right, I can take this now. I will get some of that. I won't absorb all 100% of what I have just seen. I will only ever get a fraction of that. And so they will get, all right, some people might get, I got 15%. Some people might say, I got 50%. But nobody gets 100%. And if anybody actually thinks that they do, those people are, what is the word? Delusional. So nobody gets that. And we all have to say, well, this is the base that I got. And from that, I will get a framework. I can then build on that for the next time. We get that scaffolding and we can build the next part and the next part. So I guess I say that thing that I think almost all of us will understand that, and we will know that in our heads. But we're all vulnerable when we get into our heads and we get into that kind of stressed and negative space that we see our students not getting where we want them to be or where we feel that they should be. We can, for all of us, whether it's music, whether it's medicine, whether it's whatever we're doing, we can then become very self-critical, and we can become they're not getting where they should be. I wonder, am I not doing this right? I wonder if is my program not developed well enough? Am I doing too much? Am I doing too little? Am I not teaching it clearly? And we can become part of that problem, becoming very, dragging our own self. And is it me? And we can become very toxic, often in kind of, this is my humble opinion, but I think we can be very vulnerable to being like, how much of this problem is my fault? And I'm not doing this, and I'm not doing. And we sometimes really need to take a step back and say, okay, what is happening here? And how much are they absorbing? And how much is that because I'm providing very clear instruction and I'm breaking it into the pieces that are reasonable? And what would be fair and reasonable for people to understand these are bite-sized chunks, and it is well scaffolded that people can build from. Now, I did teach, rhythm and four beats and ta ti ti, and I did teach that so kind of sequential learning that builds and builds, and that's fair. Or what is the I can't move from ta ti ticka ticka when I had half an hour and then half an hour, and I didn't see them for 3 weeks because we had the swimming carnival, and then I was supposed to see them, but then I was sick, and then the next week was stranger danger learning, and I haven't seen them for 3 weeks, and now they've all forgotten what it is, and I can't move forward. So I can't blame that as being my fault. There are situations beyond our control, and then we end up being like stressed because the report cards are coming, and they're only 7 years old. But if I don't have 300 of them marked with on a rank of out of 5, very high, like these ridiculous matrices that we have to have, 7-year-olds who have to have these ridiculous, I don't know. I really do feel sorry for people who have these silly systems. It's like 7-year-olds need to have like 5,000 word essays written about what their musical ability is. And it's kind of like, calm down, people. But
But
I'm just trying to give people some permission to say that it is okay that human beings learn in increments, and we need to understand that natural process. Because even at high levels, when the people are learning for PhDs, we still learn in increments. It is still a step-by-step process. We might get to be very in tune with what that step is for us and what that looks like and how we can streamline that. But it is still a curve. It is not a straight line up 90 degrees. There is still a gradient. So we are gradients all the way, friends. Those of us who are in education, it's a gradient all the way. It is never perpendicular straight up. For those who can see, it's not 90 degrees. It is always a curve. So embrace the curve, friends. Embrace the curve.
Oh, I've always embraced the curve. Yeah.
Oh,
And
see, I'm in my second trimester, so I've got the curve.
oh,
Good.
but I also think
over here.
Even then, it's not even a nice even curve. It's a bit here and a bit there, and then going backwards and building memories. Like you need all these little episodic memories before it goes into your. I think the brain is fascinating. We should talk about the brain a little, because I imagine you know a little more about the brain than your average person.
Very complicated organ that scares me a little bit, how complex it is.
Yeah, I think it's got amazing power. But before we leave that, the other thing I want to tell music teachers is that sometimes we need to push back a little bit. Now, I'm not judging people, and I know everyone's in very different situations, but if you're being asked to do unreasonable assessment and assessment tasks, and I think we've got to be professional and say, okay, you realize these children are 5. You realize I only see these children for this amount of time. What you're asking is actually unreasonable. I think as a music education professional with X amount of experience, I think it would be reasonable to ask them to play this game where they sing one little phrase by themselves while they're playing a game, rather than do X, Y, Z as a performance task. We have to sort of stand up for ourselves and our children a little bit and say, and as someone who is a bit of a curriculum nerd, our current curriculum is actually a little bit amorphous and blancmange, and our achievement standards can mean almost anything. So we actually have a fair bit of power within that to insist on reasonableness. So I just think sometimes we're our own worst enemies by sitting back and going, oh, okay, yes, the English people are doing that, and they've got to do that for maths, and they've got to do that. But hang on, in our situation, we think this is best. So I think we need to stand up for ourselves a little bit too.
You got one word: preach. Preach.
Thank you. Now let's get on to the Queensland Medical Orchestra. So I had a look at them on YouTube. They sound pretty amazing. Who are your members? Although I will read this quote too that I found on ABC News, because you were on ABC News. We're all musicians. There's no sense of hierarchies here. And I imagine all your members are in the medical profession. So I guess if you tell us a bit about the orchestra and then that how you work together.
Yeah, so I'll give you just a little bit of context so it kind of makes a bit more sense maybe. So the Queensland Medical Orchestra was started in 2004 by Dr. Nick Brown, who was then a medical student himself. And it was basically came out of it was called the UQMS Orchestra, which is an orchestra of medical students at the University of Queensland Medical School. And it was basically just for some fun, and it was to raise some funds for charity. And it was great. Had a couple of concerts with Jim Morrison, and so had a couple of concerts every year, and it was great. And then when, as tends to happen, it was sort of driven by the conductor, and he was kind of the creative and driving force, which was great. And then when he went overseas to be a doctor, do some further study, it kind of folded, and that was it went into hibernation a little bit. And then basically after I became the musical director for the Med Review in my second year of medical school, I was then approached and said, what do I think about resuscitating the medical orchestra? Is how we kind of talk about it in the as we talk about it over some drinks or a tea of coffee. And so I resuscitated in my third year of medical school. I was actually studying in Rockhampton at the time, but I flew down to Brisbane every weekend to do that. And we had one concert, and it kind of went quite well. And so from 2011 onwards, I've conducted it for 3 concerts every year. So this is my 14th year, 38th concert now. So it's a little bit hectic. When I started the orchestra, I had hair, and I don't have that anymore. So I don't think I can probably blame it, but it sort of feels like it's a good excuse. Not really. So the QMO is, yes, it is an orchestra of healthcare professionals. It's largely medical students and doctors, but it also has nurses and allied health professionals like physios and speech therapists and people who work in hospitals. They might work in medical admin. There are also nurses, all manner of things like that. Also people like spouses of people in the health area. We do also have some people who aren't in the healthcare field. Sometimes we have that because we don't actually have somebody who plays the cor anglais, so there's someone who comes along and they do that, or we don't quite have any French horns, so we actually have a French horn section that is rival to any orchestra anywhere, and I love them, but none of them actually are in medicine, but we call them patients, because everybody's been a patient somewhere, so we call them patients, and we love them to bits. So, we don't want to be exclusive. That's a pretty horrible way to go about things. So that's who we are. And our orchestra we have between 70 and 80 people by the time we get on stage at every concert. So we're a proper sized symphony orchestra. And we have a choir as well. We've had a choir since about 2012. So we usually have the choir for 2 concerts a year. We have 3 concerts every year. One sort of a bit before Easter, one at Christmas time. Both of them, the Christmas concerts are always lots of fun. People sing along. It's good fun. All of them raise funds for charity. The concert at the beginning of the year is also lots of fun, kind of usually a bit more light-hearted, sort of we might have some, whether it's sort of Broadway show tunes or a bit more sort of light, popular classic type things. And the mid-year concert that we have is kind of a bit more serious, artsy stuff. So ever since we started in 2011 with our mid-year concert, we call it virtuosus. We have some more virtuosic type things, and we try to showcase the amazing talent that's in the medical community. And so we actually have different soloists within healthcare that we've managed to sort of find and recruit to play different concerti or movements of concerti. And so we've played an entire piano concerto every year since then. So we've played the Grieg piano concerto, we've played the Rachmaninoff second piano concerto, the Tchaikovsky piano concerto, we've played the Bruch violin concerto, Sibelius violin concerto. So we've played these amazing repertoire, which from an amateur orchestra is pretty incredible. Now, we're probably not going to be playing at the Royal Albert Hall anytime soon, but we have a wonderful time in our own minds, and people still clap and ovate for us. So we don't mind. We love doing that. So very happy for us.
Do you how often do you rehearse together? I mean, I'm imagining that some of your orchestra members are probably pretty busy. And
yeah, So we have an interesting rehearsal sort of model because exactly as your point, Debbie, we are in general, our professionals are very busy people. And look, there are plenty of amateur ensembles out there. There's the Brisbane Concert Orchestra, Brisbane Philharmonic, Brisbane Pops. There's lots of different things. All of those orchestras involve, getting together for one rehearsal a week for the entire year. And that's great, but a lot of people can't commit to that. I don't think that I can commit to that. I'm just too busy. So the way that we get around this is we actually have, for these 3 discrete concerts every year, we have concert is on this date. A month before, we start rehearsing on the weekend. We have 6 rehearsals. So the 4 weeks before, Sunday afternoon. So Sunday afternoons for 4 weeks. The weekend before, we have the Saturday, then the Sunday day of concert. We have the Saturday before, have the concert. So 6 rehearsals total. That's it. So we do the entire concert with 6 rehearsals. So there's 6 4-hour rehearsals, pretty intense, pretty long. But 6 rehearsals, and that's it. We get to the entire, hour and a half, like 2 45-minute halves of music to put together. So it's pretty intense. Yeah, so that's how we get around it. And I guess to come back to your initial question about everyone being together and inclusive, how does that work? Medicine's an interesting thing, an interesting place. Certainly, I think one of the things that differentiates medicine, I think it's probably a little bit there in education, but a lot more in medicine. Like from my time working in high school, I mean, in most of that we have in your staff rooms and your classes, I think it's fairly egalitarian. Like I don't feel like, at least in my experience, if you were a classroom teacher, it wasn't like we're the classroom as opposed to the specialist music teachers. We're all kind of teachers. We all got lumped together. And there was a little bit of, but there's the HODs over there, a little bit, but certainly the deputies and the principals down in the admin, they were different class. So there was different sort of hierarchy in that sense, but all the teachers worked together. Whereas in medicine, it's very hierarchical. It still is, and it's not really changing, and I don't think it will be for a long time. So you have kind of the medical students are the absolute bottom of the pecking order. And then the interns who are the very first year doctors out who've only just graduated and still working out, what's Panadol and what is, morphine and what's in the middle. Like it's that kind of, they're not, I'm exaggerating, but that's, and then through to the kind of the residents who have been there for a little bit. So they kind of know what's going on, but still working out how this kind of goes. Registrars have been doctors for a while and they're on their training programs and they're becoming specialists and they're quite good, but they occasionally need to run things past the boss. And you have your consultant specialists who they really know what's going on and they kind of run the show. And then you get to the heads of department and then the heads of the hospitals. And it's this very kind of hierarchical thing. And when you're doing things like a ward round, or if you're in the surgery, or if it's always the person who is, who the most important person in the room is and who you must sort of defer to. And if you are at the bottom of the chain, you do not speak unless the person who is you need to know who the person is that you will not speak over or who you do not contradict. You always need to know who the person is, and you don't. It's very important. And in certain disciplines, it's even more pronounced. Like you go on a ward round and without trying to drop them in, surgery is often quite picked on as being one of the worst ones in this. And it often can be because some older school, it's getting a little bit better, but some particular, it can be in any discipline, but often sometimes in surgery, maybe on a ward round, and some types of surgeons will just start, with the junior, like the medical student, and they'll just start grilling the person about, the patient in front of them until they don't know any more answers and they just, I don't know anymore, and they sort of run out, right, down with you, and they go to the next person and just keep sort of grilling until they're out and they can't keep, until their knowledge is down and out, and they just sort of keep going until everybody is sort of worn away and their knowledge is surpassed. And it's kind of almost like this intellectual, almost like an intellectual pissing contest, just to make sure that everyone runs out of information. It's kind of like, see, I know more than all of you, so there we go. And they kind of, bravado, and it's this kind of thing, which is, it sounds ridiculous, but it is actually pretty awful, and it can be very, very demoralizing. And it also can be like, it's psychologically torturous, and it's bullying. It's awful in its worst form. It isn't always, but in its worst form, it can be bullying. So it can be awful. And so I mention this because one of the things that we think is an antidote to this is that our orchestra has absolutely none of that. And many orchestras and many ensembles, you will see, I guess, many of your listeners and teachers as well will see this, is that orchestras can have this sometimes too. They can have like, I'm in the front desk of the violins. I'm the second over there, but I'm not. I'm going to be the first next year. I'm there. So there can be that sense of, I was second desk of the violas last year, but I'm going to be first desk this year because they're moving on to QA1. I'm in QA2, but there's this sense of who's going to be where, and we're very strong about from the very beginning. We sit wherever, we rotate, and we don't have a sense of who's going to be where, and there's absolutely no sense of, well, I'm a consultant radiologist, and we have consultants sitting next to medical students. We have the very experienced professionals sitting next, like whatever your qualifications in life are, they count for nothing inside the sort of the bubble of the orchestra, which is great as a good leveler, but it also helps for things like networking. And so people have, they're working through that. I've just sort of finished medical school. I'm heading towards, for my first year as a hospital, but I don't really know which hospital to work at. Or I'm thinking about maybe going into, dermatology, but I don't know if that's any good. Is there there's someone over there who's got some experience in that. Can I have a bit of talk to them? So that it allows for there to be some networking, and there allows to be for some people to talk about, I'm trying to get into this field here, or I'd like to go into this, but I don't know anyone in this. So there's allowed for this sort of cross-pollination. It allows for there to be some community in a sense of getting to know people, which I think we would reasonably comfortably say that is not able to happen if there is this kind of, I'm in the violins, I don't talk to the seconds because I'm a first, that awful kind of, we don't talk to people who are beneath us. And that nastiness, so we're very strong about, have I explained that well enough?
Yes, I love it. I love it. I think it's so important. And you know what? Music can do that. Music is for everyone. Like,
absolutely. Yes, I think hopefully we're all passionate about that. But that is music in just in theory, but in practice, because this is us getting on our soapboxes here, and I'm sure you've sung this song many times before, but this is me singing my aria about this, which is that those of us who know what music is about, and we all have our own experience of this, but music is the great leveler of class and creed and color and language and religion and location and generation and age and stage and education and everything. Because when you are playing Danny Boy, or when you are playing, Sousa and the Stars and Stripes Forever, or when you are playing Schindler's List, or when you are playing, like, it doesn't matter whether it's got words or whether it is just the colors of the 1812, like, this touches us in a way that it doesn't actually matter, like, who we are, where it comes from. We all are moved by this, the way that that sound is placed in time with timbre and tone, that it connects all of us. So at the concert we just did recently, I've sometimes been called a bit of a hoe for emotion. I try to pull at the emotional heartstrings a little bit. Yes. But we did an arrangement of, so Percy Granger, who I'm sure many of you will know as a composer and arranger, he did an arrangement of the tune Danny Boy, which was, he did this called Irish Tune from County Derry, which is basically a brass band arrangement of this. And it's exquisite. Please go and listen to it. It's fantastic. And we did that actually starting off with we performed at the St. Peter's Lutheran College Performing Arts Complex, which is wonderful. And we started this actually with our choir. The audience was just sitting there, and we didn't actually introduce the song. We just started with, so the audience were there, and we just sort of, they'd clapped the piece before, and I said something about that was that piece, and just out of nowhere, the choir just started singing the tune of Danny Boy, no words, but just singing the tune of that, and started descending down the aisles on the side, and just that tune of that in unison. And they came that down and then onto the stage slowly. And then, and only after that, they sang the first verse with the words in 4-part harmony, and then transitioned straight into the brass band arrangement, which is exquisite, of her Danny Boy. And people I was crying, people had goosebumps. And I did that deliberately because I know that that's a song that people have a lot of different relationships with. It's a song that I personally have played on my viola at a number of people's funerals, because that's something that a lot of people associate with funerals, but not everyone. Some people got that as it was part of at a church service, or they've learned to play that on the piano when they, like, it's a song that people have a lot of different connections with, but you don't need to have words with it, because the tune just does something, and it connotes emotion, and it takes you to a place that you don't need words to take you there. And you don't need to be, oh, I understand this more because I am this person, or I am of this status. It doesn't mean any of those things. You don't need to have this much education, have this much money, have this much. You don't need any of those things to have that make you start to feel something. None of that's important. It will hit you where it hits you.
Absolutely. It was one of my dad's favorite songs. Yes, it
Yeah.
means different, and I will break down if I hear it. It's,
Yeah.
yes, it's music. It's the power of music, isn't it? So
Hmm.
you obviously think music is really important,
Hmm.
obviously.
Yeah. I imagine some 1 or 2 or 300% of your listeners will too.
Yeah, I think so. I think so. 1000% of them. Let's go with that. So, from your experience as not only with the orchestra, but as a GP, and general life experience, and even your European ventures, um, why do you think, from your perspective, why do you think music's important? Now, obviously, we've been talking about that fact that it's the great leveler, that it means something to everybody. But what other sorts of things do you think make music unique in our human experience?
Hmm. So I'm going to try and put a little bit of my serious pants on and talk a little bit about some things that maybe I can bring to this discussion with my medical and music hats on at the same time. Um, Obviously, we all know that music has so much to offer, um, but and I'm trying to say but too often, and there is a growing body of evidence about the value of music in terms of things like health benefits, and it's in that regard the importance of music in our lives, and I guess I talk a little bit about that for to try and encourage um, you, Deb, and also your listeners about why this is important. Um, so not just about the things that you probably will all know already, and for things like in PD about things like teaching kids about creativity and expression and emotional intelligence, but so we've known for quite a while that music itself is a powerful, euphoric. It lifts our mood. It helps us um, with our to feel and things like that. And in a time when we are seeing a very, mental health is a very significant issue in the world, and the burden of disease around the world. Something that I think was probably one of the things that perhaps was one of the reasons you connected with me was the interview that I gave on the ABC. So I'm a GP with my serious hat on, and the College of General Practitioners, so the college that I'm a part of, every year we collect data about saying what they get about 1,000 GPs every year, and they sample data from them and say, what are the issues that you see patients coming in with? And they collect, today I saw cough. Today I saw a child with rash. Today I saw someone with chest pain. I saw this, I did a vaccination. All right. So they all sort of, what are the things that you saw? Tabulate all this, collect it all. And we say, what are the issues people are seeing in general practice? For the last 5 years in a row, the most common reason for presenting to general practice is not cough. It is not, medical certificate. It is psychological medicine. People coming in with issues about stress, depression, anxiety. That's the most common reason people are coming to see their GP. So I think that's really
Is
important for us
it
to think about.
really? That's
Yes, I'm not kidding.
the
I can
past
send you
five
the
years.
data. 5 years in a row. It's not just a fad. It's not just a one-off blip. It's a consistent trend. We publish this data to send to anyone who will listen, trying to say, this is why we need to fund mental health in this country. So without me getting onto a rant about that separate issue, I raise that as being, this is why, if that's what's going on, and I say that in some way, like the people who are listening going, oh, well, that's, that touches me a bit. Well, you are not alone. This is why Australians are having issues with their mental health. We know that, obviously, evidence says things like talking therapy, talking to somebody, very important. Antidepressants, if necessary, absolutely, really helpful. There are lots of other things that can be helpful too. Diet, exercise, lifestyle changes. There are other things that are helpful too. But we also know that music is very helpful and very powerful. Music can be a very helpful and powerful antidepressant. If we're finding ourselves to be very blue, for many of us, it can be, if I need to get out of that funk in our heads, we might go and listen to one of those pieces that just helps us to stop thinking about that sadness, or tries to lift us from that. I'm just feeling so, whatever the next word is, so blue, so meh, so numb. Music can be something that can lift us out of there that other things will not. So that's something that's really important to be aware of. Music has a very powerful effect on our brain, on our body. It can do those incredible things. So music is something that's important for mental health, but it also has not just important things on the mental health of our brain, but other aspects of our brain function as well. We know that there's evidence that music can have important impact and also benefits on cognitive function of the brain, in terms of working in improving outcomes in people who are from early to late stages of dementia. Music can have benefits in that situation. Neurodegenerative disorders, music has been very powerful, and there's some amazing videos you can see on YouTube. I'm still moved by. There's a couple of you can see these kind of things. There's a beautiful video of the people in nursing homes, these patients people in nursing homes with these terrible, debilitating illnesses who kind of sit there and they're just sort of tremor and they're shaking. And I remember seeing one of a lady who was actually like a prima ballerina, and she's just sort of reduced to sort of just shaking in a wheelchair. And they put some headphones on her and they started playing Swan Lake, and she stood up out of her wheelchair and she started doing like a half pirouette, and you're just going, like, just listening to the music kind of transformed her back to this world that she knew. And like she had Parkinson's disease, but this kind of transport, like in the ways that you kind of go, how is the brain doing this? How is it able to kind of do this to her in ways that all of the drugs that we have, we don't know how to do this, but music, it's just amazing. So music can do these things too that we don't know how to do. Music can do other things too. Music is important. There's a whole subspecialty in medicine called palliative care, about helping people through the last days of their lives. And music is a very important part of that too, to try and maximize quality of life as people are, in the last phases of their life. It can also be very important in the beginning phases of their life. Music is important as people are preparing to birth, children, or even for neonates who are in humidity cribs and who are not, if they're, 32 weeks and they're not actually at 40 weeks of gestation yet. So music is important from the very first day of life until the very last day of life. So, and there's other things that I could be talking about then too. So music's important from day one until the end. And without wanting to sound like I'm just listening to the sound of my own voice, something that's also very interesting, I think it's interesting to me, I hope it's interesting to you, is that there's a new sort of phenomenon starting within medicine that we call social prescribing. And doctors have been prescribing medications for years. We prescribe blood pressure tablet, we prescribe diabetes medicine, we prescribe this, and so doctors, we prescribe medication. But there's more and more things now in terms of we prescribe something like a social activity, and this sort of happened a bit through COVID. People talking about there's a lack of interaction, and so one of the sort of more accessible things that people have heard about this is so everyone's sort of heard of this thing called park run. People on a Saturday morning get together and they go running together. And if you ask me, you couldn't think of anything worse. Like, who wants to get together and go running? What an awful idea. but it's terribly good for your cardiovascular system. I didn't say that as a doctor, but it just sounded like an awful idea. Anyway, but the social prescribing is saying, look, people who are feeling isolated and they're feeling depressed and they're this, that, and the other, social prescribing is saying, well, maybe not, let's not launch into saying, let's give you some Zoloft. Well, maybe let's say, why don't we try and say, let's connect you in with the local park run group and let's try and connect you to this pathway, and not just say, oh, look, go and do it. Actually connect you to a pathway that says, go and do this. And this can have almost as good outcomes, sometimes just as good outcomes, in saying, here, script, go get, take, see you in a month. So trying to connect through these kind of pathways, and I guess trying to get in that kind of vein is saying, well, why don't we connect people with saying, well, if you're not really keen on taking pills and you say that's not what you really want about, and maybe you don't even need that, maybe it's not the best thing for you, why don't we try to connect you in with some music therapy? You know, students can actually go to university and get a degree in music therapy. Why don't we try to connect you in with tapping it, particularly with people who are creative and who've been kind of, who've abandoned that part of their life, particularly because that might be their depression has sort of shut them off from that. Why don't we try to connect them with it? Why don't we try to help them to tap into that part that's kind of been blunted off by that sort of mood disorder? Why don't we link them in with that? For some people, that, you know, it's not for everyone, but for some people, reconnecting with that music, with that art, with that creative part of their body, their brain, for some people that might be just as effective, or it might be at least the part that starts that ball rolling and getting them towards that little bit of sunlight's peering through the dark cloud. And so I guess, I know I've talked for a bit, but I hope that's something about just helping people to understand humans need music. It is not an optional extra. And I hope that many people sometimes feel that specialist teachers in primary schools and even in high schools as music teachers kind of like, well, look, reading, writing, and arithmetic's the important stuff, and you guys are just an added on. Yeah. And I've always liked the line in Mr. Holland's Opus when they eventually cut the music program, and he says, well, you know, if there's no music, and pretty soon they'll have nothing to read and write about. And I sort of think, well, that's, you know, a bad way of putting it. So it's enough of me talking for a while.
That was amazing. I did refrain because it might have mucked the mics up a bit, but I did want to give you several amens during that. That was just amazing. And also what popped in my head was pub choir, which I think that's fantastic. Been an
great
amazing
idea. I can put that together. That's a brilliant social prescribing. So that's a great thing to do for people
I've had
isolated, anxious.
Yeah.
Fantastic.
I had a chat to Astrid on a previous podcast too. So actually I'm booked in for the end of June pub choir. I don't make it to too many, but talk about joy and social connection, and you know, the person next to you is suddenly your best friend, and it's like there's just something that's proof that the dopamine or whatever it is released.
Absolutely.
As soon as you start singing together. And I can have a little plug here for Together Sing, our little new annual event. The whole purpose of Together Sing was for music, group music making for well-being, you know, and I think we have the science now. We have it. I mean, I link to studies that I read summaries of and think, I haven't read it in depth, and I'm sure it's a bit beyond me, but I know that the studies are there. Like Anita Collins with her Bigger, Better Brains, and there's a whole lot of fabulous stuff being done that's proven that music lights up your brain like nothing else. Every part of your brain, emotional, primitive, motor, every part of your brain, not just the mathematical center or the whatever. So I don't understand people that are cutting music and the arts generally, but of course we're talking music specifically. I don't understand it when we know how good it is for us.
I'll say amen to you. We can do amens in both directions. Mutual Appreciation Society.
Love it.
It makes no sense. And we don't necessarily have an
answer. Can I just ask permission from a GP? Is it okay as a layperson to give some social prescriptions to other people?
Absolutely. And in, I guess in all seriousness, I think it's important. I mean, I would maybe on my soapbox that I would encourage, I would encourage your listeners to really think about the importance of this, because this is something that's important, I would say, in twofold. One, it's important for your listeners, for them in their general life, because they will have, it will be for colleagues, if there are colleagues that you see in the staff room that you're seeing they are, over the course of the term, if they start to become more and more despondent because life's just getting too much and it's the deadlines are coming, and or whether it's colleagues, it can also be family members. It's, you know, it's, life is getting tough for lots of people, and it's not for everyone, but you see people switching off, and you know, it can be something that you say, you might not everybody is psychologically literate, and not everyone can say, look, oh, you know, this is, you need to go and have some, you know, cognitive behavioral therapy, and let me talk you through some strategies for, you know, distress tolerance. And not everyone can do that, and that's fine, not supposed to, but we can think about ways. How about, do you want to go come to pub choir with me, like what you just suggested? That's a great idea. Or, you know, there's a band playing, or I've got tickets to come to the, you know, Together Sing or Medical Orchestra. Like, there are things that we can do in the idea that it will either foster connection or it will foster creativity in music, or both together, which is kind of like the Venn diagram of just amazing. So that's important, and that can be something that, without being uber dramatic, it can actually save lives. And with that bearing in mind, we can actually connect that into what you're doing in the classroom, because that, sure, it might be difficult to kind of feel like you're doing that when you're doing that with grade 2s, but if you're doing that with grade 6s, grade 7s, and if you're starting to make those connections, even if you're going into early high school, you know, grade 9, 10, 11, these are times when students are starting to really move so developmentally. This is when we're trying to get through the phases of who am I, as opposed to I am just attached to everyone around me. I am a part of my family unit. Actually, no, I am differentiating. I am not my parents. I am my own person. I am attached to my social group, but I'm not quite the same as them. I am my own person, and I need to be around them, and they define me, but just part of me. But now they're rejecting me, and how do I fit in the world? And am I fat? Am I thin? Do the boys like? And it becomes the weight of the world. And we know this because we see students get these giant headphones that they basically cement onto their earlobes, and they turn their music up ridiculously loud. And if we don't sort of in some way recognize that they're doing this already, how do we encourage them to use this in some way, shape, or form, not to listen to music that makes them want to cut themselves? Because that's using, I guess, it could be 30 seconds of CBT. That's we all experience distress in life. All of us do. Mm-hmm. Do we use it in a way that, do we cope with this in some way by processing it in a way that is destructive, i.e. listening to music that's going to make us want to cut ourselves, or do we listen to music that will help us be constructive? So when I talk to my patients about this, we're trying to say what's going to be constructive, what will be destructive. You know, destructive is, you know, now going to eat through a 0.5 kilogram block of chocolate. Constructive might be to say, well, I'm going to sit with a cup of tea, and, you know, or finding ways that are going to be more constructive than destructive. And how do we do that? And helping students to understand the idea that, you know, actually, I really do feel happy if I sit and listen to putting together a playlist. This is the playlist of things that actually helps me to feel happy. Great. You can be a guide to a playlist. This is 2023. We can do that. We can do Spotify. We can do iTunes. Like, there are ways we can do that. And that's giving students an emotional and a creative language to use expression. That's not just, I'm going to sit there and I'm going to watch TikTok with random things that come in that might be, they might be, oh, there's more proof that my body doesn't look the way it's supposed to. There's more proof that everyone's got a boyfriend and I don't. There's more proof that everyone's got beautiful makeup and I don't. You know, that's not controlled. That might become more and more distressing. And next thing you know, you're getting more reinforcement of your body dysmorphia, and it just goes down the toilet. So there are ways that we can use music and art and expression to help people to actually tolerate this distress in a way that is constructive, and channel the benefits of music and the benefits of, you know, these kind of things we've been talking about. So never underestimate the ways that you can start to role model and set examples for, even just in talking about it in the classroom, but I made a great playlist on the weekend, boys and girls, and I did this and the other. You can just start to drop little things in there. Always ways you can be doing this. So never underestimate the potential for revolution.
I love it. Love it. Heal the world with music.
And at least make the possibility for it, and one brain at a time. Or if you're in a class of 27, I guess 27 at a time. But even if you just get 1 out of 27, that's huge.
Ripples. That's the other thing I know it's a bit cliched, but that ripple effect, I just think we can't underestimate that either. That little change that we've made with that one child in that one class that can spread. I think that's amazing. You've said some fabulous things. I really love what I quickly wrote it down so I didn't forget. Connection. If you've got connection and creativity and both together, that would be the Venn diagram of amazing. I think that's, oh my
I like
goodness.
Venn diagrams too. But
Look, Ryan, I haven't met you, and I know it was until tonight, and I know it was very cheeky of me to contact you and say, look, let's do a podcast. But I am just absolutely delighted to have been able to speak to you and hear all of the things you're saying that just everything resonates, supports all of the things I believe. I just feel really uplifted and inspired.
Great. Excellent. Glad I can be part of that, because you're obviously doing a great thing yourself, because you're not, I'm not trying to blow air up your skirt or anything, but it is people like you and your listeners who we are part of I like to think I was part of that too when I was in teaching like that. We are not the arrive at 5 to 9, leave at 3:05. We teach for 5 hours a day, and that kind of, you're obviously getting there before then. You get home and look, it's nighttime now. It's getting, for those who aren't, it's now 19 minutes past 8 in the evening, and you're still creating music and working on things. So this is part of who you are and what you're doing. So, you're clearly somebody who's living and breathing your passion and putting that into practice. So it's nice to also be part of, chatting to and working with a like-minded person who's putting so much into what you are doing. And I guess putting your money where your mouth is not the right, there's probably a better way of saying it, but it's getting late, my brain's shutting down. But I would like to affirm and so into what you are doing and giving into the world by being passionate about music. And so I appreciate what you're doing. So well done to you.
Thank you very much, Brian. Look, I'm going to finish on this high note because it's wonderful. I don't know if I'll be able to sleep now, but that's. But I would really like to chat with you again one day. Yes, I just might.
You deserve it. You absolutely do.
Oh, thank you. And so do you, because you look like you're still in your office. So
something like that, yes.
So
I finished work here, so once I've done here, I'll pack up and go home. So.
Thank you so much for giving us your time, and we are all much richer for having met you.
Oh, my pleasure. It wouldn't have been. It needed to be a two-way street. It wasn't just me giving a lecture. It was us going backwards and forwards. So it takes two to podcast.
Oh, I like that. Thank you so much for being my podcast pal. Bye, Ryan. Thank you. As we know, laughter relieves stress. Don't lose sight of the funny side of life. I was going to buy a book on phobias, but I was afraid it wouldn't help me. Thank you so much for watching our Crescendo Music Education podcast. For more information about all things Crescendo, including membership and music education resources, visit us at crescendo.com.au. Don't forget to like and subscribe.